I mean, every single step of what people were doing was closely regulated and supervised, and we ended up with not a single known case of transmission or COVID-19 illness in that bubble, so that worked. But if a couple of those NHL players were to come over to your house and sit down next to members of an extended family for Christmas or Thanksgiving, and there's no masks being worn, no one's being tested coming or going, there is people spending several hours right close to each other, sharing food and drink, doing all of those things that are most likely to cause transmission. I'll come back to the Costco or Walmart example. You know, yes, there might be now with a 15% restriction, 250, 300 people in an enormous box store, but they're all wearing masks. They've all hopefully followed the rules and sanitized their hands on the way in. They, in many cases, are being checked for symptoms or asked about symptoms. That was certainly the case with the NHL every single day. They're at most passing somebody in the aisle for a second or two. Compare that to sitting around a table with 6 or 10 or 15 of your close family members for hours, sharing food and drink, laughing, hugging family members. That level of intimacy is what makes it so much more likely for the virus to be spread. Doctor, would you like to correct me if I'm wrong about that or comment on that?
That's correct, and I would just comment that, of course, the World Junior Hockey Championship is being held in Alberta this year. And so in addition to the example that you provided with the NHL, I have written an exemption for the World Junior Hockey Championship to be able to continue as long as they follow those same rigorous protocols that were very effective with the NHL. And I will just say that it is a judgment call with respect to having to cancel that event versus allowing it to go ahead with safety protocols. I am 100% confident that that event does not constitute a risk to public health because the protocols are rigorous and have been tested in the NHL playoffs. So that event, again, is not a risk to public health. What I think that I've heard some people concerned about is the element of fairness, that people who live in Alberta can't play hockey right now, whether they be children or adults. And yet we are creating this exemption to allow hockey players from other countries to come in and compete in the World Junior Championship. And I acknowledge that that's a judgment call and it's a hard choice, and that many people are being asked to sacrifice their ability to play team sports right now. I will just say that I made that decision again based on the fact that I was confident that public health would be protected with those protocols. And I know that the World Junior Hockey Championships for many is a source of joy, and that it could be done safely without that risk to the community. And so I did make that decision to provide that exemption, and again recognize that for some people they would disagree with that judgment call, but that is the call that I made based on the fact that it does not provide a risk to the community.
Thank you. So Bruce Yetman asks, what are you going to do to get the CPP from Ottawa before it's all gone? Okay, another non-COVID question. Thank you, Bruce. I think implicit in Bruce's question is the federal government's running huge, unprecedented deficits and debt, and that may, I think his question suggests, imperil the future of CPP. So the answer, Bruce, is that the government of Alberta, based on the recommendation of the Fair Deal panel, is doing a deep technical study of the potential cost, benefits, and structure of an Alberta pension plan. We're looking at the successful model of the Quebec pension plan, which has operated separate from the CPP now for 60-some years. The strongest argument for Alberta doing this is that we have by far the youngest population in Canada. So effectively, our CPP premiums constitute about a $3 billion subsidy to Canada Pension Plan beneficiaries in other parts of the country. And the idea in principle is that we could repatriate that money to improve benefits for Alberta seniors and or reduce taxes on Alberta workers and job creators to help our economy. But as you could understand, it's a hugely complicated issue. And before we make a recommendation to Albertans one way or another, we need to do a much deeper technical study, which is being undertaken right now by the Department of Treasury, Board and Finance. Sam Ritter asks, if you have allergies, do you recommend that they take the vaccine? That's for you, Dr. Hinshaw.
In the UK, as you likely know, there have been 2 reported instances of allergic reactions, severe allergic reactions to the vaccine. And our National Advisory Committee on Immunization has looked at that evidence, those 2 reports, and has determined that just like any vaccine, that we would make sure that people knew what the ingredients were, and that if they were allergic to any of the ingredients, then of course we would not recommend that they take the vaccine. One of the ones that they had specifically flagged in the latest update that they did to their guidance is something called polyethylene glycol, which is something that's often used as a laxative to treat constipation. And so if someone has an allergy, for example, to that component, then of course they should not take the vaccine, as it could potentially cause that allergic reaction. Those kinds of allergies were not seen in the more than 40,000 people who participated in the trial to test the vaccine's effectiveness. And so, of course, we continue to monitor very closely for any kinds of signals. And that is, of course, why in the UK, when they had these 2 instances, they did a very careful examination, and they initially changed their assessment in the UK to indicate that anyone who had a very serious allergy, so carried an EpiPen, had an anaphylactic allergy to anything, would not receive the vaccine. But again, after very careful review and consideration of all of the evidence, our National Advisory Committee felt that it was most appropriate to limit that restriction to those who have a severe allergy to the components that are actually in the vaccine. And that does align with the recommendations, of course. With any vaccine, we never recommend that somebody who has an allergy to those components receive the vaccine.
All right, next question goes to Mr. Larry Grant. These internment camps planned to be built, are they for people who refused the vaccine? Well, Larry, I can tell you Alberta is not building any internment camps. I know there were some stories a couple months back about the federal government having done a RFP for quarantine centers. And my understanding is that really dates back to the spring. You may recall when we had a bunch of Canadian citizens stranded, they were in China, in the Hubei province where Wuhan is located. They were coming back, and quite sensibly, the federal government wanted to quarantine those people. To be blunt, Larry, I wish that they had done so more broadly for people coming back from hotspots then, including northern Italy and Iran. I think that would have maybe helped to prevent travelers from spreading the virus here unwittingly. In any event, you may recall that back then in March or April, the federal government took, I think it was 200-300 Canadians from Hubei, Wuhan, and put them into CFB Trenton, an Air Force base, I think, for the 2-week quarantine period. So I think they were looking early on at expanding that for returning travelers. But I'm not, an internment camp is not an accurate description for any of that. And in terms of what we're doing as a province, Larry, we've leased about 1,500, 1,700 hotel rooms that people can voluntarily choose to move into for a couple of weeks. They're not locked in their rooms. There's no armed guards. There's no fences around. These are hotels. But if they need to self-isolate so they don't infect the people they love and live with, but they can't safely do so at home, then we're giving them an option. It's their choice, not the government's choice. There's no internment aspect of it whatsoever. And secondly, Larry, there will be no mandatory or coerced administration of the COVID-19 vaccines in Alberta, period, full stop. So I wish you folks who are opposed to vaccines in general, and the COVID-19 vaccine in particular, would take yes for an answer. There will be no mandatory, coercive, compelled vaccination or inoculation. In fact, to make that point absolutely clear, when the Alberta legislature resumes for its spring 2021 sitting in April, one of the first items of business will be amendments to the Public Health Act, in which we will be removing the power of mandatory inoculation that has been there since 1910. We don't know that it's ever been used, but in order to remove the anxiety that some folks have about potential forced vaccines, we are going to remove that legal power. And the Prime Minister, with whom I disagree on many, if not most issues, himself has said the federal government agrees with that. They have no intention of mandatory vaccinations. So, folks, I know that there are some of you out there who, for whatever reasons, are just dogmatically opposed to vaccines. I think that's unfortunate. I wish you would take a close look at this to help keep everyone safe, but it's your choice at the end of the day. No mandatory vaccines, no internment camps. And how about we turn the volume on that stuff down just a notch? Because, quite frankly, I think since the beginning of COVID, we've seen a certain degree of kind of promoting fear on both extremes of the debate. We don't need that. We need to come together as a community, support each other, and exaggerating fears like that I think are really counterproductive. All right, Jace Miracle says, Mr. Kenny, what's your position on Justin Trudeau's OIC gun ban? That's Order in Council gun ban. What are you doing and willing to do to stand up to Trudeau for Albertans' firearms rights? Thanks, Jace. The answer is that we, as a province, will be appointing our own chief firearms officer to be responsible for the administration of the federal firearms legislation in this province. MLA Michaela Glasgow from Brooks Medicine Hat is leading province-wide consultations on that and related questions to get input from the community of law-abiding firearms owners on how we can more effectively fight back against this federal overreach. I would point out that law-abiding firearms owners are not the problem. Criminal gangs who import illegal firearms from the United States are the problem, and that's where the focus should be. We are also considering potentially supporting one of the many legal challenges of the Order in Council to which you referred, Jace. Kevin Rittinger asks, how many of the questions are you answering have been pre-staged for this broadcast? Well, I'm going to ask my staff, have any been pre-staged? Are these all questions that people have posted? So Kevin, you can, that's been confirmed for me that none of these have been pre-staged. So you can go through every question that we've selected and find that they've been written into the comment section below by a real person with a real Facebook account. None of this is pre-staged. And I think the proof of that is that we ask some pretty tough questions that are critical of the government. Happy to do that. Brian Hebson says, what do you see outdoor events looking like next summer in Alberta? Example, fairs, pro sports festivals, etc. Do you have a model that outlines what COVID needs to look like for events to take place? That's a really, really good question, Brian. We're just starting to get our heads around that. I've said to Dr. Hinshaw and our team that I believe that by the end of February, we need to give a very clear signal about what summer events might look like. I am hopeful that with the plateau in cases we're seeing now, plus the expected decline in numbers coming from our most recent restrictions, and the growing positive effect of the vaccination program, that we will be in a position by the summer significantly to reduce, but not completely eliminate, public health measures. What exactly the implications are for that, for summer festivals, for the Calgary Stampede, for rodeos, etc., we don't yet know. But I'll just go out on a limb here and say that for outdoor events, I think we have more flexibility than we do for smaller indoor events for obvious reasons. But we'll be turning our attention to that in the month of February. Dr. Hinshaw, would you like to add anything more to that?
No, I think you're right. First of all, as you said, we do need to give a little bit, not a little bit, we need to give certainty or ability to plan well in advance. We can't make a decision on this in June and expect people to be able to actually go forward. So that's very clear. I think we know at the moment that this virus has a very clear seasonal pattern of spreading much more easily in the winter than in the summer. We also know that the summer doesn't make it go away entirely. So I think, Premier, your comments are exactly what I would say, which is that there's lots of things that we anticipate will be in place by next summer that will be protective. And at the same time, it's likely we will have to have some kinds of measures, protective measures, but hopefully less than we needed to have last summer, because of course we're going to have a lot more protections in place and more vaccine available, for example, than we had last summer. So I do think there's hope, and we'll have to see as this vaccine campaign is rolling out, and as we're learning more from other countries that have their summer season right now, what we can do next summer, but I do think it will be better than last summer.
All right, next one goes to Stephen Dennis Stows. I'm a Canadian Forces Afghan combat vet. How far does this go? What's the level of freedom you're willing to take from the citizens to keep them safe? Is there a line in the sand that you will not cross, that you won't cross? First of all, Stephen, thank you very much for your service to our country and our uniform in Afghanistan. And thank you, secondly, for raising a very important question about our fundamental freedoms. I've been, I think, perhaps the only government leader in Canada publicly to express my deep reservations about many of these restrictions because of the impairment of constitutionally protected rights and freedoms that some of them represent. And what I've said is that, as our Constitution makes clear, governments can abridge fundamental rights and freedoms if those abridgments are reasonably justifiable in a free and democratic society. What our courts have said is those abridgments can only be done, and they can only be justified if there is a clear and compelling public policy reason, which I would say in this case is to avoid the complete overwhelming of our healthcare system and mass deaths. Secondly, if the abridgment or the limitation is proportionate to the, so in other words, if the policy goal is proportionate to the liberty that has been abridged. And thirdly, if the abridgment is limited. And that is the framework that, and Dr. Hinshaw will tell you, I mean, I'm often kind of get up on my pulpit about this when we're discussing these issues within the cabinet, because I am concerned that in this COVID year, there has been a tendency by governments to almost rush to abridgments of rights and freedoms without thinking this through very carefully and making those abridgments only a last and limited rather than a first and maximum resort. So, Stephen, that's my kind of a theoretical answer. In a practical way, while there have been abridgments of people's ability to earn a livelihood, which I profoundly regret, for right now, I would estimate under 10% of Alberta businesses. Most rights and freedoms have continued unabridged. You're able to ask a question like that. We're not abridging your freedom of expression. People are going out to protests. I don't like it if they're doing that in a way that is not careful, but they are exercising those rights, freedom of association. Freedom of religion. We are the only province, I think, that has allowed churches and places of worship to stay open throughout. Yes, with limitations right now in terms of numbers and how people worship, in terms of physical distancing, masks. But fundamentally, we've tried to strike that balance. So all I can tell you is there is no perfect formula for the right balance. But I truly believe that the vast majority of Albertans would not accept it if we allowed the virus to run free without any effort to control it. If we went from, right now, 750 people in hospital with COVID, with exponential growth, if we went from that to 1,500 to 3,000, we would be past our maximum capacity in the healthcare system. And then we would be, as the voices of panic have suggested, at that point we would be setting up tent hospitals. In the middle of the winter in Alberta, our doctors would have to be triaging patients, deciding who not to give care to. The average age of COVID hospitalization in Alberta is 60. Just think about that for a second. Yes, the average death is 82, people with multiple comorbidities, but the average age of hospitalization is 60. There's a lot of otherwise healthy people in the prime of their life who end up in COVID getting care in hospital. How many of our grandparents would we say in that catastrophic scenario were no longer able to provide hospital care to in Canada, in Alberta? That is a price that I think, well, very few people are willing to pay, a risk that very few of us are willing to take. So what we've tried to do, Stephen, I admit imperfectly, is to find that balance which respects and allows the enjoyment and exercise of fundamental rights and freedoms with minimal impairment while preventing that kind of out-of-control scenario. And I'm sorry for those of you who think we haven't done this correctly, but please understand, my challenge to you is, what would your advice be to us as decision makers? To take off all restrictions in the middle of the winter when we were facing exponential growth just a couple of weeks ago? How many lives are we prepared to see lost as a consequence of that? I agree, by the way, to be clear, I've said from the beginning that this is not about eliminating risk, that we're not chasing zero cases like some jurisdictions have. I think the price is too high to pay for that. You know, just like the government doesn't eliminate the risk of road accidents by barring people from driving cars. We don't eliminate the risk of heart disease by barring people from eating, bad food or whatever. But so we assume in a free society that there's a certain amount of risk, but in a pandemic like this, the risk could be in the order of thousands of lives for our most vulnerable citizens, our seniors who built this province. And not only them, but the thousands of people whose surgeries would be canceled. You know, I had a constituent whose wife had her scheduled surgery postponed, and he wrote me a furious email. Why are you allowing this to happen? Well, that happened because more and more COVID patients in the hospital have displaced regular surgeries. He and his family are right to be upset. Those are the real world consequences, not theoretical or abstract consequences of allowing the virus to grow to a point where it really jeopardizes our healthcare system. I'm sorry I went on a bit of a rant there, but those are the kind of considerations that we're trying to balance. We're past in a 1 hour mark, and I think, well, I'll speak for, I don't know about me, but I suspect Dr. Hinshaw has been working already a 16-hour day. So why don't we just take two more questions? BG Sonoma says, will the government allow businesses to demand people to be vaccinated to use their services like concerts, airlines, schools, etc.? So BG Sonoma, the answer is I don't see how they could do that, because we have a Privacy Act which does not allow anybody to ask you about your health status unless it's for a very specific, narrow purpose, like, for example, applying for insurance. And we have no intention of providing or of cooperating with those kinds of demands. I keep reading about this idea of a vaccine passport. Well, people are not going to be getting a vaccine passport from Alberta. We're not going to be issuing proof of vaccination. That is a private medical decision that you make, and it stays private as far as we're concerned. And as far as I'm concerned, unless it's for a very legitimate purpose, like applying for life insurance or something, a company has no business asking about your health status. Aurora Allure says, how are you going to help with the inevitable increase for mental health support? A very important question, Aurora. And we we believe there's a lot of data points that add up to a significant mental health challenge here. We had one before COVID. So the answer is, before COVID, Alberta's government had surged $150 million in additional support for mental health and addiction services. And at the beginning of COVID in the spring, we added another $53 million in support. Everything from the Kids Helpline for kids coping with mental health challenges to expanded drug treatment supports and much more. We've appointed for the first time in our history, a Minister for Mental Health and Addictions who's leading those efforts. And if we need to provide even more support, we certainly will do so. Let me just give you a little important bit of information. There is, I read online, a widespread view that we've had a huge increase in suicides in Alberta related to COVID restrictions. We are very concerned about suicide as the worst manifestation of mental health challenges. We've been following the numbers very closely, and I can report to you, this has been released publicly, that for the first 6 months of this year, our suicide rate was 19% below the average for the past 5 years. We've not yet published the data since for the months since July, because we go back and we try to be very careful about ensuring the accuracy of that data. But I can just tell you this, that the numbers have stayed stable, thank goodness. We have not seen an increase in the suicide rate in Alberta this year. So far it's below the average for recent years. But we do believe, the mental health experts at least believe, that there may be a delayed reaction from the stress that people are under, and we'll be keeping a very close eye on that. I got one more question. Why does Klaus Schwab say life will never go back to normal and that these lockdowns will be a part of our lives now? Oh, that's from Rachel Keeper. So for those of you who don't know, Mr. Schwab, Klaus Schwab, is the president of the World Economic Forum, also known as the Davos Summit, the recent author of a book called The Great Reset. I've commented on this before. He sent me a copy. I have not read that. But I probably should read it. I've said before I'm not going to bother, but I should probably inform myself. Apparently, I hope this is not a apocryphal quotation, but I've read in commentary articles that Mr. Schwab says that within a decade or something, he foresees the end of private property. So I got to go back and verify the quotes myself. But as I've said before, a lot of this just sounds like regurgitated socialism and ideas that have failed catastrophically throughout modern history. And that's, you know what? We live in democratic societies. People are free to put forward those ideas, and if they can get electoral support for them, that's how democracy works. But the idea of exploiting a crisis like this to advance a particular political agenda like that, I think is just awful. And I just thank you for the question. All right, Doctor, we seem to have run out of questions for you at least, and we're going over time, so I will wrap this up. Thank you very much, Doctor, for joining us. I know you work so hard. And by the way, I'm just going to say, Dr. Hinshaw, look, I get a lot of criticism, but that's fine. I signed up for this. I'm elected and accountable to 4.5 million Albertans. Dr. Hinshaw was hired based on her expertise and experience as a member of our permanent professional public service. As a senior, she's an assistant deputy minister at the Department of Health. She is a public health expert who has served Albertans in that capacity. She grew up in Sylvan Lake County in I think, third generation Alberta farm family. Is that right? Fourth generation? So Dr. Hinshaw is an Albertan through.
My grandparents homesteaded, yep.
There you go. Dr. Hinshaw is an Albertan through and through. I'm a relative newcomer. Like a lot of Albertans, I grew up in Saskatchewan and came over here. So I just wanted to say, I just appreciate our chief medical officer. Folks, you may disagree with various decisions that have been taken. I'll share with you a kind of a joke. Stephen Harper, when I was in his cabinet, used to say, people would approach him at hockey games and say, you know, Mr. Harper, I may not agree with everything you do, but I appreciate you. And he would say, I don't agree with everything I do either. By which he meant that in government, sometimes you only have bad choices, and you don't always get the optimal choices. So that's how I think both Deena and I have felt through, as anybody in a position of responsibility through this COVID period, that often we've only had bad choices or not good choices. Yet we've tried to make those choices with balance and in the public interest. And I just want to appreciate Dr. Hinshaw, a fourth-generation Albertan who truly has a heart and a spirit for public service. And while I signed up for the public criticism, she didn't. Normally, public servants are outside of that range of public criticism. She has been receiving that, and I regret that. But I just want to say thank you, Deena, for your amazing work this year, the sacrifices that you have made, the wisdom that you have brought to all of this as our principal advisor on public health. We truly appreciate it. I wish you and your family a joyful Christmas. And by the way, tomorrow is the last day of Hanukkah. So to our Jewish friends, let me say for the last time in 2020, Hag Hanukkah Sameach. And to everybody who will be celebrating in one way or another, Merry Christmas. And I can say that we are all looking forward to closing the book on 2020 and starting anew in a more hopeful year. So thank you, Deena. Thank you all.
Thank you. I assume we're offline now?